Yes, it's new. They're just starting to be used in oncology trials. They're being used for the ones I've seen so far are being used for sleep and stress changes. In particular, the stress and anxiety measures are super interesting because a lot of patients experience nausea, and that's one of the terrible, side effects of the treatments. And to some extent, that's the treatment, but to some extent, and possibly in some cases a much larger extent, it's the anxiety of going in. They're tossing their cookies before they even go in because of the memories and helping them see the data that, this really is an anxious response, and here's something you can do to support it. Sometimes gives them a sense of greater control and management, which is really helpful, right, when cancer is running through your body, right? Anything you can do to enhance a sense of patient self-efficacy that then results in them feeling better. And then when you feel better, you can manage everything else better. So when you go in to for the treatment, you're less likely to be, very sick and needing somebody to talk to you for a long period of time, or maybe you even need somebody to talk you into going back to the hospital, right, or to the treatment center. So managing the patient stress and anxiety, I think, is an undervalued but great, you know, contribution to improving their health. There's also improvements now in measuring lots of the other side effects. So the devices are being put in trials also for monitoring autonomic changes that relate to CRS, which is another new area. So that's very exciting.